Welcome to Get Healthcare, where we're running a weekly podcast exploring some of the benefits and some of the difficulties in running an online GP practice. And we'll also be answering any questions that you might have. So if anyone wants to pop in a question, more than happy to answer those questions. If anyone wants to send in any questions to us via email or on socials or anything. So today we're going to be looking at workplace health needs, and Dr. Nick Flynn has joined us. Thanks for joining us, Nick. So I'll just start off with a question. So what are the biggest challenges Irish businesses face in ensuring employees' health and compliance with workplace regulations, Nick?
Good morning, Dylan, and I'm delighted to join you on the Get Healthcare podcast. So as anybody who runs a small business knows, or indeed most people who work in any business knows, the Irish employment regulatory environment is quite complicated, and there's a complex framework really of health and safety regulations that small businesses, or all businesses, have to comply with. When you're running an SME with limited resources, there is such a drain on resources that it can be quite difficult to meet all your regulatory requirements. And certainly there is then the opportunity for online providers to help small businesses meet their regulatory requirements, from pre-employment medicals, sickness work absence reviews, mental health support, to increase or help them with their compliance with the regulatory requirements of employment law. So I think that from a point of view of the challenges that businesses face and how I suppose online telemedicine, and in particular Get Healthcare, can support those businesses, it would be in helping them to comply with the regulations in a method that is accessible, it's easy, and it's convenient, but also in a model where the costs are more affordable than your traditional occupational health and bricks and mortar healthcare providers.
Okay, very good. And so, how would you feel? I suppose you've kind of touched upon it, but how does online GP support fit into the broader conversation about workplace wellness?
Well, certainly, I mean, it's the same as with, I suppose, all online services. Whether you're shopping, or whether you're accessing healthcare, it is suitable for some episodes of care and not suitable for all. So where employees, where the role that they are undertaking does not require the physical assessment that some jobs do, for example, assessment of colour blindness, or maybe a hearing assessment, where it's where those I would say maybe complex in-person assessments are not required. An online pre-employment medical is absolutely appropriate and suitable. The online space is accessible, it's flexible, it enhances employee engagement. So we find that because we're flexible and we can, for example, if an employee is unwell and missing from work and they need a sickness absence review, they don't have to go to the trouble of going to an in-person clinic, especially when they're unwell. They may not feel that they're able to do that. So so it's, I suppose, accessible and flexible are the main advantages, as well as, of course, the advantages that we're able to bring through making it more affordable.
Perfect. So mental health is a major concern in the workplace today. How can online GP services provide timely and accessible support from a mental health perspective?
I suppose it allows the employees to address the issues in a discreet and convenient way. There should not be a stigma with mental health. Mental health and mental unwellness it has the same priority for doctors as physical unhealth and physical unwellness. But employees may feel, or patients may feel sometimes, a stigma around that, and are slower to come forward. And the online consultation, I think, reduces that. Again, it facilitates, convenient, on time, from home appointments. And sometimes people who are feeling very unwell with their mental health are unable to leave the house because of anxiety or agoraphobia, So it certainly, in a mental health space, is very, very appropriate. It also, from the point of view of follow-up, it makes follow-up very easy. You don't have difficulties really in online appointments booking your next appointment with the doctor. So from the point of view of accessibility, reducing stigma around mental health, and ease of follow-up, telemedicine is an online consultations as we provide with Get Healthcare. And I think an important innovation with Get Healthcare is the addition of a psychology service to the platform. So now, as well as Irish trained, Irish registered general practitioners, we also have a team of psychologists available to support the patients. And personally, I found this very helpful, and it absolutely then mirrors the bricks and mortar, or the traditional space, where the doctor, when we see a patient and the patient needs the support of a skilled, trained and competent talk therapist in the form of a psychotherapist, we now have that service available within the team at Get Healthcare. And while the same boundaries around confidentiality exist, it's also fantastic that where a multidisciplinary team meeting is required with the patient's consent, that because we're the same team, the GPs and the psychologists can discuss patient care and create a care plan that's more holistic than either practitioner practicing on their own.
Brilliant. Can online GPs work alongside employers to create mental health strategies for their teams?
Yes, is the brief answer to that. So the accessibility of mental health supports through the online space for employers is a great service to be able to offer to their employees. We can integrate with their on-site wellness programs. So where we would see that in I suppose in the real world is that employers do say maybe 1 month on increasing physical activity, and increasing how active the employees are, and we can tie that in to a talk on the mental health benefits of physical activity. And so then the employees get, as well as the prompts to become more physically active, they can get from our service one of our psychologists or one of our doctors giving a talk for the employees through one lunchtime that can be recorded for playback at the employer's convenience and the employee's convenience, about the benefits of that initiative. So the increase in their exercise and getting active, for the benefits that will have on their mental health. So we see that those type of integration wellness programs, they sit well. We see employers are doing this a lot more to increase employee wellness, engagement, retention. These are very important services that can be offered through the online space for employers and employees. And I think as well, that from the point of view of employers who are employing new employees in an area. So if you're in an industry where you're hiring people who have to then come into the area to work, we know that the challenges are housing, education and healthcare. And the online, like a relationship with an online provider like Get Healthcare, can certainly help you fix one of those three problems and make healthcare accessible for your new employees, be they people who live in Ireland already and relocating, or people who are coming from abroad to live in Ireland for the first time. Accessing healthcare and accessing GP care is a real challenge, and Get Healthcare can help to alleviate this or help fix this problem for any employer.
Definitely. So, with regards to absenteeism, what impact do online GP services have on reducing absenteeism in the Irish workplace?
So that comes into the general approach to absenteeism, which would be to have a robust pre-employment medical, setting the employee's baseline health, and then looking at, what are there specific health risks with a particular role in a particular industry, and then structuring the surveillance of the employees or workforce around the risks that exist and helping the employer to mitigate those risks. But also, from the point of view of, the GP service itself, and just having access to swift early GP appointments. A general rule of thumb in healthcare is that the earlier that you access care for an illness, the less severe, less treatment, and less time that it lasts for. So where you've got in the traditional space employees who it may take a week for them to see a doctor with a chest infection, and then they may need another week off because they're on treatment. In the online space with Get Healthcare, we have same-day appointments so that those problems can get treated in early course, and then the course of the illness should in most cases be less. So there's the accessibility part as a GP service, but then for an employer that was looking for an occupational health service, which is of course different, there is the pre-employment surveillance and sickness absence reviews, a lot of which can be done through remote and online consultations.
Okay, very good. And then from your career so far, are there any success stories that you can broadly outline from working with the business in the past?
In relation to the online service?
General improvement.
The biggest success.
Yeah.
Yeah. So the biggest success for me in Get Healthcare's journey to date has been the addition of the psychology service. So prior to this, I would say that probably 25-30% maybe of our consultations related to mental health problems, and the choices that you have with the mental health problems. The doctor on a consultation gives some advice, arrange a consultation again in a couple of weeks' time and see if things have improved. You can advise the support of a talk therapist like a psychotherapist, or you can prescribe medication. Generally, you're only prescribing medication for the most serious cases of mental health problems. And the majority of patients who attend the doctor online or in person with mental health problems are not at the level, certainly in the first consultation, where they need to have a prescription for medication, and therefore it's the advice around their sleep, their relationship with maybe alcohol or drugs, their exercise habits and their dietary habits, very important. But also then the support of a professional psychotherapist like a talk therapist who's trained and qualified to bring a patient through that journey. So the addition of that psychology service to Get Healthcare has been fantastic, and I've seen those improvements with patients that and as well, I suppose the satisfaction a patient has that we're not reaching for a prescription on the first consultation, that we're able to provide them with this talk therapy support. And so that is probably for me the biggest success story of the Get Healthcare journey to date.
Very good, very good. Do you see online GP services becoming a standard benefit for workplaces in Ireland?
So I see more than that. I see the hybrid model of online and in-person GP care is going to be the industry norm going forward. Yeah. We're going to have not the online, the access to online healthcare absolutely was accelerated by the pandemic. There was an awful lot of learning. There was technological advances. The GPs and doctors learned how to use online services safely. Patients engage with online services all the time, and our learning from the pandemic is that while some conditions need to be seen in person, and while some patients prefer in person, there is a large group of patients who are very happy to safely engage with the online service. So in general, I see online is an important part of the provision of healthcare, and it's here to stay. When it comes to the question which you asked about the integration with employers and employees. Again, there's two parts to that. There's, we can provide at Get Healthcare a GP support service for employers, and certainly that helps with employee wellness, employee satisfaction, and employee retention. So that's going to be an important part that's certainly into the future. And as well for an employer who has more than one site, maybe in more than one county, the online provider provides a consistent, reliable solution for accessing the GP care. And similarly for occupational health service for employees, which of course is different to the GP service and is structured differently. But again, as we discussed earlier, for pre-employment medicals, for workplace illness absence reviews, for back to work reviews and back to work certification following an illness, and also for helping the employer to reduce risk in the workplace. And the online providers are absolutely well positioned for that.
Yeah. Okay. Are there any particular industries that you think would be great partners for like online GP care, like specific industries that might find a greater benefit than others?
I think service industries are very well aligned with online GP care. So I mean, any of the outsourced business providers, really, they have large office-based employee workforce. My experience is that a lot of these workers come from abroad.
Yeah.
And when they come from abroad, they don't have a home GP in the area where they're going to. Mm-hmm. And so the online space and Get Healthcare can absolutely support these employees, these employers. We're seeing ourselves as well in the healthcare space for healthcare assistants and administrators in nursing homes and in other healthcare settings. The online pre-employment assessment is very convenient, it's cost effective, and it is absolutely appropriate for those positions. There are some roles which it would be like unsuitable for, clearly. So for example, drivers, pilots, ones for physical in-person assessments of eyesight, hearing, are required. These will not be suitable for the online space.
Yeah. Okay. And then broadly, what trends do you see in the future of workplace healthcare?
So, workplace healthcare, again, just I suppose to be clear for anybody listening to the podcast, there are two aspects to workplace healthcare, and they are different. So the first one is GP care for employees, mm-hmm. and that's your traditional GP care, and then you've got occupational health. And occupational health really is about the employees' fitness to work and helping the employer to maintain a healthy workforce. So both of those aspects we're going to see a growth in telemedicine and remote healthcare providers, and we've already seen this surge starting to happen. Those employees access healthcare remotely, conveniently, and it reduces, from an employer's point of view, time away from the desk. So as well as that convenience bit, there's they're not leaving the workplace to access their appointment. Mm-hmm. So an appointment is 15 minutes. If they have to go somewhere, you're talking about maybe an hour there, an hour back. So, a morning off work for a GP appointment. Whereas the telemedicine remote service provided by Get Healthcare allows this to happen in 15 minutes. So they're literally away from the desk in a quiet, private space to take the call, and then back to the desk. And it's, maybe 20 minutes, half an hour, rather than that morning off work. And of course, we're seeing, we will see, because mental health supports and mental health and the addressing mental health issues is so suitable to the remote space. We're going to see a growth in this area, and it won't be just about the treating of people who have established mental health problems. It'll be about helping employers to structure programs to prevent mental health in the workplace. And again, that's something that Get Healthcare is well positioned for employers. We have a team of doctors and a team of psychologists. We can run wellness programs online for employers to promote employee engagement in healthy activities and avoiding I suppose activities and behaviour them unwell. We can also see personalised healthcare becoming more focus for employers, and at Get Healthcare we can certainly personalise the solutions, tailoring the benefits of our programs to meet the specific needs of a workforce. So if a workforce, for example, is particularly sedentary, we can help structure programs that increase activity at lunchtime, that activity breaks away from their desk. We can work with the psychology team around this as well. So personalised healthcare is going to be another growth. And then, as we've kind of touched on already, we'll have the option of health and wellness programs, preventive programs, and then the integration of benefits for employers. It'll be very important, so through Get Healthcare, clearly now it's not only the GP service they can access, they can also access a psychology service. Very important for maintaining a healthy workplace. And then as time goes on, the online providers will have more data. So, and through our data, we can anonymise it with patient consent, and and help employers to address any health risks that are that we're seeing through engagement with their organisation. So that would be the main ways I see this. See online healthcare, improving and changing through engagement with employers.
Okay. If and I kind of know the answer to this question from a commercial point of view, which is just pop us on an email, but from a medical perspective, if an Irish business or an Irish business owner or HR professional is listening, what would you say to encourage them to explore online GP services, and how would they reach out to us, or what should they have in line before they make contact with us?
So the first thing is that Get Healthcare is an end-to-end GP and occupational health provider in the online space. I would encourage any employers who are looking at providing as a benefit to their employees access to an online provider to reach out to us. There are benefits for the employees for this, because it is so difficult to access healthcare at the moment. There are benefits for the employer. It'll increase employee engagement. It'll increase employee satisfaction. It's a very good perk for employers to be able to offer to employees, but also for the employer there are benefits. We can provide very, very competitive plans for employers to access the service for their employees, including co-payment plans. We can also assure employers that we run to time, so that their employees will not be waiting around for appointments, and will not be spending a lot of time away from the desk traveling to appointments. So there's an efficiency there for employers that should result in a productivity benefit for employers. And finally, just in the occupational health space, where appropriate, Get Healthcare can provide pre-employment medicals, assist with workplace surveillance, and provide sickness absence reviews online where appropriate.
Okay, perfect. That's everything covered for today. I think we ran through a good bit there. If anyone wants to reach out to us, gethealthcare.ie is the website, info@gethealthcare.ie, and more than happy to take a call for any employers or business owners who are looking to come on board. Join a call with myself and Dr. Nick, and we'll be able to run you through the platform and some of the benefits of it. Thanks so much for your time, Nick, and we'll leave it there. That's episode 2 done. So hopefully we'll keep it rolling now and do one every week.